Okay, Callum is doing the Ironman. He's got medial shin splints. So you've got two types of shin splints. You've got the anterior or posterior. So tib posterior, which sits under the shin bone, is one of the main muscles responsible for medial shin splints. And obviously the other muscles are flexor hallucis longus and flexor digitorum longus. So flexor hallucis longus is the big toe flexor, and tib posterior sits under here. So what I've done is I've got him to dorsiflex and evert his foot, and I've put the tape. This is how you tape for medial shin splints, so shin splints on the inside, not shin splints on the anterior aspect. I put a tape with no stretch down here, and it inserts into just under the medial malleolus onto what's called the navicular bone. The clever bit is what we're going to do. We want to grab. I've got I've had some needles into his this medial part of his leg anyway, or tibia or tib posterior. And what you need to do is kind of gather it all up to take the stress off it, and then apply the lug. So what you do, you pull the end off here. What you've got to do is this is where he's getting the pain, lift it up and place it down, so you're taking the stress off the bone. If you leave it untreated, it can cause shin splints, and then after shin splints can cause what's called a compartment syndrome as well, where you have to do a fasciectomy and release the pain or release the tension. So basically pull one lug at a time, and we just pull it across here, and then we load it up the side of his leg like that. And then again we pull the tissue up, release the leg like this, or the lug, lift the tissue, and again take the pressure off that medial aspect. And then what we do is give it a rub, and you can see that we've dorsiflexed, everted, put the normal stretch on with tape with no stretch, and this one we've applied sort of 60-70% of stretch, but lifted the tissue off the tib posterior off the bone and done it up the side there. So that's how to tape for medial shin splints.